you can look at the same story and see yourself as a victim or as a survivor. And there are a lot of really cool stories with the animals. So a lot of them have disabilities. A lot of them have come from abuse or neglect. They learn to be part of a herd, a family. They're happy. So I think that sharing those stories can be a really good catalyst for starting to see their story in a different light.
Welcome back to the Sina Good Health Podcast. Today we're talking with Heather Krohn-Miller. She is a therapist and she's also working on setting up a animal farm sanctuary. So Heather, you want to say hi and kind of talk about So let's start with just kind of talking about your background and the transition from your clinical and prison work to setting this up.
Yeah, so I have my master's degree in forensic psychology. My first job out of school, I worked as a community mental health worker. And after that, I went to one of the state hospitals here in Minnesota. I worked with people that were hospitalized under their civil commitment and worked with the people that needed to be treated back to competency. So the court had ruled that they were not competent to stand trial. So we had to treat them so they could get to a point where they were competent. And that oftentimes includes medication and education. I did that education piece. After that, I started working with the Department of Corrections. I am a program therapist there, specializing in mental health release planning. And I'm currently going to school to get a certification in animal and human health through the University of Denver. My passions have kind of changed in the last few years. I found out what really happens in the animal agriculture businesses, and that profoundly changed me. And I became very passionate about working with learning about farm animals. I started volunteering at the Farmers Day Animal Sanctuary in Lindstrom, Minnesota, and they are interested in doing some mental health programming and having mental health counseling sessions there. So I'm in the process right now of setting up a private practice where I will be doing some work with clients out at that sanctuary and hopefully be getting some skills groups going out there as well.
Okay. So can I ask you quick, can you kind of explain what forensic psychology is? And then we'll go into what kind of therapies you're planning to use at the sanctuary.
Yeah, for sure. I get a lot of people thinking that forensic psychology means I'm doing psychology with dead people. That is not accurate. It simply means the intersection of the court system and psychology. So you're looking at people that do the competency to stand trial work. You're looking at therapeutic interventions with people in the criminal justice system. You're looking at expert witnesses that testify in court, things like that.
Mm-hmm. Yeah. We don't need to go down that rabbit hole. I mean, it's interesting, just it makes you think of the faking insanity and
Mm-hmm.
I mean, I don't know how quick it is to dispel that kind of stuff.
Yeah.
We can move on to, so what kind of therapies are you planning to use at the sanctuary?
Yeah, so I would say my primary modality is mindfulness cognitive behavioral therapy. So cognitive behavioral therapy in a nutshell has to do with learning to observe our thoughts and figuring out which thoughts are helpful, which thoughts are harmful, which thoughts are not rooted in reality, and learning the skills to then challenge those thoughts and change those thoughts. Mindfulness CBT combines a mindfulness component, which is basically being right here in the moment, observing what's going on with you, including the thoughts. That's why it goes together so well. Seeing what type of physical sensations come up, looking at your surroundings. It's really truly being rooted right here, right now. And that's a powerful modality because a lot of people with depression, anxiety, their minds are living in the past or the future or the what ifs. Whereas mindfulness teaches us right here, right now. So you think of people that are highly anxious about what might happen in the future. They have all of these catastrophic thoughts about car accidents and hurricanes and whatever. Mindfulness teaches us I'm here right now and I'm safe. So that is what I tend to use most often. There's a new one. It's coming more out of the UK from what I can tell, but it's coming over here to the States. It's called compassion focused therapy. So that is doing the mindfulness-based CBT stuff through a lens of compassion. And a big part of that is self-compassion. And I've been using that quite a bit with my clients. I do also do private practice on the side currently. Mm-hmm. I've been using that a lot, and I'm finding that it's really empowering and it's really healing to learn how to have that self-compassion piece and really start understanding your worth and loving yourself no matter what's going on around you, right? Narrative therapy is another one that I'd like to use out at the farm. So narrative therapy is basically looking at a person's story and really examining it, learning about yourself through the lens of the stories. And at times it's kind of rewriting that narrative, right? So you can look at the same story and see yourself as a victim or as a survivor. And there are a lot of really cool stories with the animals as well. So a lot of them have disabilities. A lot of them have come from abuse or neglect, and they learn to love. They learn to be part of a herd, a family. They're happy. So I think that sharing those stories can be a really good catalyst for letting people open up about theirs and also starting to see their story in a different light. Mm-hmm. I'm also very interested in attachment therapy. My husband and I adopted our kiddos out of foster care. So I've learned a lot as I've been raising my kiddos about what trauma looks like, how that affects attachment, and how attachment difficulties can permeate like every part of a person's life. So using attachment therapy at the farm can be helpful. And so oxytocin, and we can talk more about this when we get to the part about the physiological benefits, but I find it really fascinating because being around animals releases the hormone oxytocin in us, and that is the bonding hormone. So having that being triggered in people that are working with the animals, probably bringing families in. So having that hormone going in people that we're working with will hopefully strengthen the connection with their families too. So I've got a lot of plans.
Yeah, well, that's actually was the next question on the list, was talking about like how the animals help with the therapies, and we can start with the physiological benefits and then kind of go into the more skills and stuff.
Yeah. So take all of this with kind of a grain of salt, because there is a decent amount of research, but there's also some problems with the research. A lot of the research does not have very large sample sizes, and there's just really not enough of it right now. It's kind of an up and coming modality as well. Right. So I'll tell you what some of the research has found, but it's an area that really does need to be explored more. So Michelle Morrison, I'm trying to cite my sites. I don't know, I didn't get them all, but I'm trying to do it the right way. So Michelle Morrison in 2007 reviewed all the available literature that was out at that time. And she found that there are decreases in blood pressure and heart rate, in depression, anxiety, loneliness. Perkins found that people with dementia who were around the animals, their agitation decreased and the social interactions actually increased. So I don't remember off the top of my head what exactly that program looked like, but I'm guessing it had to do with the nursing homes having the dogs come and visit. You know, that's another intervention, animal assisted intervention that that happens frequently. This one I think was interesting. Oncology patients who were doing chemo. Some in the study had dogs in the rooms with them, some did not. And the ones with the dogs in the room had more improvement in oxygen saturation. So there's a lot more that I didn't get to, but
yeah, but there's always stuff that's pointing towards it being beneficial, even if it's not enough being done with the sample sizes and stuff to kind of super solidify it, I should say.
Yeah. Yep.
So one question along those lines is like, ironically, the phrase chicken or egg came up. But I was wondering about like, is it because people like the animals, or what if they don't like animals? And
right.
And then like for someone like myself, I grew up not having pets and kind of not wanting them, and then through my wife and their family dog, I became very much a dog person. So
yeah. So that's a big part of what I'm learning in the certification is how do you find the right people for these interventions? We can't just say, oh, anybody who's interested, you know, come hang out with us. We do need to screen for things like dislike. People might have phobias. People might have differences in culture where they don't like a certain animal. We also have to look for things like allergens, health-related issues, you know, so a lot of screening has to happen before you do an animal-assisted intervention. And I think that's where having the education is important. There currently is not any certification or training that's required to do it. So a lot of people will just start doing these type of programs, but it is important to have a basis in the ethics of doing it and how to make sure to keep people safe. So yeah, I mean, if a person doesn't like animals, they're probably not going to have the benefits that we're seeing here. But as far as ethical research, I'd have to assume that those people were probably selected out.
Right. Well, and I'm wondering about like I know like goat yoga or alpaca yoga, like those type of things that are not like full on therapy, but just kind of doing stuff with animals.
Yep.
So let's see. So let's touch on so we talked about the physiological benefits. So what about like just the other kind of benefits of having an animal involved with the therapy? Like when we were talking before about just like, for example, learning social skills if you don't relate to people very well, but you might be able to relate to the animal.
Yeah, absolutely. I think there's a lot that animals can bring to the therapeutic setting. Comfort's a big one, right? Going to a therapist, especially one that you're not really familiar with, talking about these deep, dark secrets, it's not easy, but a lot of people find comfort with the animals and are more willing to open up because they feel supported. It's interesting how people can feel like they've got more social support with the animal, even though it's not like a person, obviously. I mentioned the narratives, perspective taking. That's another thing that I really want to be teaching, especially young people, how to see the perspective of other people, how to understand what they're going through. We had talked about kids with autism and those social skills, that perspective taking is almost always lacking. So I think this is a good way to do that kind of education in a way that's fun and engaging. Grounding, keeping yourself grounded and again in the moment, using those mindfulness skills. One skill that I want to teach to the people that come out there are, what's going on with your body and how do we calm your body? Because if you're tense, if you're running around, if you're screaming, the sheep are going to run, right? They're not going to want to be around you. So in order to get a visit from the animals, you need to learn the deep breathing. You need to be calm and quiet and that kind of stuff. So motivation is another piece. It might be, like I said, calming your body so you get a visit. It might be, we need to do X, Y, and Z, and then before you leave, we can go see your favorite cow. And social skills education might look like, how do you make eye contact with an animal? I really find pigs interesting because their eyes can look very human. And some kids who have experienced trauma or maybe on the autistic scale have a hard time making that eye contact. So it might be helpful for them to do that with an animal as kind of learning to make what's socially appropriate with the eye contact. I've got some more research too that I can talk about, though that stuff was just kind of off the top of my head. So this other lit review that was done in 2015, Majin, I think is how you say the name, Pepping, Kendall, they suggest that these animal-assisted interventions can help a wide variety. And they mention autism, they mention even psychotic disorders, which I find really interesting. And I don't know if that's somebody that I would have to think about that if I want somebody who's actively psychotic doing animal-assisted therapy. Mm-hmm. But if they're stable, maybe. Trauma is another one that uses this modality, another disorder. It helps people that have a hard time trusting other people. They can see the animals are trusting this therapist, so maybe they're not so bad after all. They can act as a secure base for people as they're going through these hard stories and learning this stuff that's tough. They can kind of be a source of safety. There's some animal-assisted interventions. I'm not sure that this is one that we'll do on the farm, but just overall, some interventions have to do with training dogs, and that can give people a sense of mastery and confidence. So, yeah.
So we've got the next two questions are kind of opposite sides of the coin. So what kind of animals are you, well, you said you've got like 25 right now. So what animals do you have / planning to have? And are there animals you're wanting to avoid?
Yeah, so we have pigs, goats, sheep, and cows right now. I think we might be getting chickens at some point, but those are the species that we have. Animals to avoid, I probably won't be using like the bigger cows. We're not going to be going out into their pasture. It's just too much of a risk. Mm-hmm. There's a couple goats that don't particularly always want to be around humans, or kind of get a little feisty if you don't give them their food. So there's a couple goats I don't trust that we will not be working with. As a general rule for animal-assisted interventions, you should never be using any wildlife or exotic animals, even if they're tame. You shouldn't be doing it. So going out to a wolf sanctuary, not advised.
Yeah. Well, and I don't know if you know this offhand, but just like I asked you about, like with emotional support animals, like I think it's primarily dogs and cats. Just something with I'll say a higher level of intelligence. So it's not like, my pet turtle or whatever.
Yeah. Pigs are actually one of the most intelligent animals.
It's like them and dolphins and parrots.
Yeah, like gorillas. I think gorillas is up there. But yeah. So do you want me to talk a little bit about like the differences in animals, emotional support animal, service animal assisted interventions?
That's the question I've got after this next one, but it might be good to stay on this topic and then we can come back to that one. So go ahead. Let's go with that.
Okay. So animal assisted interventions is kind of an umbrella term. And under that umbrella term, there are animal assisted activities. So those would be where the animal gets brought into the hospital and the nursing home, and it's just for a visit. It's not like a treatment plan. It's not an intervention that is for a particular purpose, for a particular person. That's when we get into the animal assisted therapy. So actually having a treatment plan, having goals outlined, and being very thoughtful in why we're doing this intervention, what are the outcomes, etc. There's also animal assisted education. There are things like go to the library and read to a dog, that kind of stuff that incorporates an education piece. There are that's all animal assisted interventions. Now, outside of that is the animal or the emotional support animals. So those are going to be the animals that actually live with the people, and they have the job to be a comfort. That's different than a service animal, which is trained for a particular task, whether that's letting a person know that they have a seizure coming on, or somebody who is, seeing eye dogs would fit into the service animal. So yeah, those are kind of all of the different categories.
So with the animals you do have, just do the animals get along with the other species, or do you kind of have goats with goats and cows with cows? Or
at our sanctuary, they're all split up by species. I know other sanctuaries have the species all together. So I think that's just a case by case, sanctuary by sanctuary kind of decision.
It might depend on the animals too, because like my in-laws family dog, well, they also have a cat, and my sister-in-law, and I actually just did a podcast with her, she graduated from massage therapy program, and the cat must have watched her giving massages enough, because the cat will like massage the dog.
That's awesome.
Yeah. So that's what I was wondering about, like animals getting along with each other. And we'll get to that next, but are there types of treatments that don't work well with animals?
Yeah, that's a good question. As far as in the psychology realm, I would guess more psychodynamic approaches would not work well. I don't really know how that would be incorporated. But yeah, that's the only one I could come up with as I was thinking about that question.
What is psychodynamic stuff?
That's like Freud, going through the childhood,
Sure.
looking at dreams, looking at archetypes.
Okay. So let's talk now about, like, can you just kind of explain the concept of what an animal sanctuary is?
Yeah. So the animal sanctuary that I'm partnering with again is Farm Estate Animal Sanctuary. It's a sanctuary that takes in farm animals that have been abused or neglected. So our animals come from a wide variety of places. Some are retired working animals. So we have some that were in the dairy industry and the owners retired them out and gave them to us. We've got a few that were from the industry but had health issues, so couldn't be used for the industry. We have a couple that have escaped live markets. We've got, huh?
What do you mean escaped? Like snuck
I
out
guess
the back door? Or...
they must have like somehow, I've never been to a live market, so I'm not really sure if they're like in cages or tied up, but they've somehow escaped. So yeah, there have been other ones that have been removed from their previous owner because of neglect and abuse. So there's a wide variety of animals that come to our sanctuary.
Okay. And then can you tell a story about, we talked about the mother and son cow and the seeing eye?
Oh yeah. Timothy and Megs. So Timothy and his mother were rescued from a dairy farm. That was one of the cases where there was the extreme neglect. And his mother had a major growth on her face and actually had to be put down right after being saved. There was no way that she was going to get better. And Timothy was still a young cow. He was very young. He had severe pink eye in his eyes. So both of his eyes ended up having to be removed. So we've got a blind calf. And then shortly thereafter, I think it was a dairy farmer, I'm pretty sure. They have this cow that has a spinal deformity. So she was not able to work. She wasn't able to be milked. She just kind of hung out on the farm as a pal. Like they kept her. So had a spinal deformity, couldn't be used for dairy production, was handed over to us. And Timothy and Megs, the dairy cow that couldn't be a dairy cow, they've formed a really tight friendship. And Megs ended up taking care of Timothy. She's basically his eyes. So she will lead him around wherever they need to go. At dinner time, she'll lead him into the barn and he will follow. They're always close together. They play. Like it's really, really cute. They really do love each other.
Yeah. I just thought it was a cool story, so I wanted to make sure that got
yeah. So. And that's a story that I would like to use too for kids who are adopted or kids who have some sort of disability. Because you look at Timothy and he's just a young cow that loves to run and play and get pets. And
yeah, well, and it's like it didn't click with me until like later, like more recent my adult life, but like the movies Finding Nemo and Finding Dory, it's same kind of concept.
Mm-hmm. Yeah.
So let's talk now about the kind of, I don't know if symbiotic is the right word, but just kind of the aspect of kids and patients healing and then the animals healing and then together.
Yeah. It's really incredible to watch that. to see people connecting with the animals and them getting something out of it too. That's one thing that we learned very early in my certification, is that the animal assisted interventions need to also benefit the animal. We're not to just take a dog that doesn't want to be interacting with people in because it would help the people. We need to make sure that there is a benefit to both. One animal that I'm thinking of using pretty often is named Blue, and she's got one eye and 3 legs, and she loves people. She will come up and meet everyone. Because of her disability, she doesn't really get to be with the big herd. So I think she kind of sees people as her herd. Mm-hmm. So having that and knowing that she's enjoying herself, that's important too.
Yeah. Yeah, it just reminded me of, like, are you familiar with Temple Grandin's work?
Yeah. Yep.
Okay. For people listening, Temple Grandin designed, like, what do you call it, meat processing places, and she was able to kind of consider the cow's perspective. And I'm basing this off me seeing the movie more than being in the industry, but she was able to kind of picture how cows like to move, like in a circle, to get through the fences and look out for the dangly stuff that freaks them out and all that. So
yeah, Temple Grandin has autism. Mm-hmm. And one of the reasons that she thinks that she was so effective in coming up with these ways to get cows to slaughter in a less stressful way was because she thinks the way that she believes the animals think, and that's in pictures. And she says most people think in words, but that didn't really make sense to her. She thought in pictures, and if the animals think in pictures, well, okay, like we can use that to, I guess, help with the experience.
So the next question is, would a kid or a patient theoretically, like, move on or graduate to, I don't know if the right term, but more conventional therapy? And then, like I mentioned in the note about, like, when I was researching this, it's animal therapy should assist but not replace other treatment.
Yep, absolutely. I think they could theoretically move on or graduate. I don't think it's necessary though. And in fact, I'm not sure that kids wouldn't want to after hanging out with the animals. Like I said, my modality is that mindfulness-based CBT, which is what I would be doing in an office anyways. And I'm just having the animals there helping out to kind of bring the concepts more to life and to get them motivated and connected and interested. But no, I think that the therapy that I'll be doing at the farm is going to look very similar to the therapy that I do in the office, just a little bit more enhanced and way funner.
Yeah.
Is it more fun? More fun.
So, and I know this is not going to have a concrete answer and it's going to be case by case, but, like, what does progress look like?
Yeah. So it would depend on the treatment plan. Let's talk about social skills. If if the goals are to increase social skills, it might be communicating needs. Okay. How can we practice our communication? And maybe it's too much to practice talking to another person. Can you share some things with the animals? And then come to us and share some things. It could be with the mindfulness and the grounding, calming your body, being able to calm the body at the farm and then generalize it to another area. It could be, how do I see myself? Can I see the things that other people, other beings would see in me? It's going to feel really good when you go hang out with the pigs, and they're excited to see you and they know you, things like that. So, and we can measure that by a couple different things, asking about what their conversations are that they're having with themselves. What do they believe? With kiddos, we'd have to kind of do other ways of measuring. We probably have to talk to the parents, and see what they're noticing as far as their self-concept, the kids' self-concept. But I think that a lot of the targets, a lot of the indicators of success, a lot of the treatment planning is going to look similar to the traditional in-office therapy. Just the interventions are tweaked a little bit.
Sure. Yeah. And I do want to go back for a second. Like when you're talking about self-compassion, it's just like, and I'm speaking for myself, but I'm not the only one. Just like I'm very good at beating up myself. So
Yeah.
like,
yes.
Why do people struggle with that? Like with self-compassion?
It's partly just the way that we are wired. The best explanation that I've heard is from Dr. Christopher Germer and Kristen Neff. And I actually have the book on my desk. It stays on my desk because I use it so much.
Yeah.
These two are like the gurus of self-compassion. And they say that the self-criticism is basically a survival mechanism turned inward. So you've heard of fight, flight, freeze, right?
Yeah.
So fight is turned inward because maybe a person doesn't feel like they can effectively fight outward, or there's this weird abstract danger as opposed to an actual danger. So we think of like a school exam, right? That's not an actual danger. There's nothing to fight. When it's a situation like that, that fight doesn't go away. It gets turned inward. There's also this misconception that a lot of people have that self-criticism is motivating. And it's really not. There's a lot of research that shows that people that are self-compassionate are more motivated, are more likely to reach their goals because they know it's not going to be a complete failure if they miss their goals, whereas sometimes that fear can paralyze somebody from pursuing their goals.
Right. And not to turn this into my own therapy, but how do you balance, like, you talked about like motivating yourself, so self-compassion versus like just kind of pushing yourself versus like when are you being nice to yourself and when are you being lazy,
Yeah, there's also a lot of research on that, and there is really no correlation between self-compassion and laziness. Again, I think you have to have a view of what's healthy for you. So, and an honest view, right? You need to be honest. What is helpful for you next? Is it really gonna be to sit around and watch 12 more episodes of Catfish? Maybe, but it might be to go to the gym because you know that you feel way better after you go to the gym. And going to the gym is a self-compassionate thing. Studying for a test, right?
Mm-hmm.
It can be self-compassionate to go study for a test because you know that is going to be helpful for you. So it takes a lot of introspection, but self-compassion is really a great way to balance your motivation, your drive, and also making sure you get the rest that you need.
Yeah, well, and I'm wondering about, and you can tell me how off base this is, Tim Urban, he runs the website Wait But Why, and he talks about, he has a TED Talk and everything about procrastination. And the concept that he talks about is like just being nice to your future self.
Absolutely. And that's where that question, what is the most healthy decision for me right now, would come in, right? Is the healthiest decision really to put it off, put it off, put it off? Is that really going to help you? Maybe if you're exhausted and you really do need a nap, but most of the time it's going to be better for you and your future self to do what you need to do.
Yeah. Okay. So we got a couple more questions just kind of about the sanctuary itself. So like, are kids the focus, or who is like welcome? So like, how would somebody go about getting treatment or visiting?
Yeah, I think anybody is welcome. I like to work with all ages, but most of my career has been spent working with adults. I would like to do groups, like maybe an elementary school age skills group and an older kids, teenagers age group, and then maybe even an adult group. But yeah, I really think that anybody can get a lot of benefit from animal assisted therapy.
And is the place open for like if somebody just wants to visit the animal sanctuary part and not get treatment?
Yep, absolutely. Farmers Day Animal Sanctuary has tours every Saturday for the summer. I think they wrap up late October. So yeah, it'd be great for people to go out and meet the animals.
Okay. So the sanctuary part itself is open, or how soon are you going to be starting your program?
Yep, the animal sanctuary part itself is open. It's been open for a few years now. I am probably going to make the jump to my own private practice in fall. So shooting for September, October. I am officially registered as a business, and it will be called Oak Haven Counseling and Wellness. So yeah, anybody in the area, watch for that.
Yeah, and you're in the Twin Cities, right?
A little bit north. My office is going to be in Chicago City. I live in Isanti, which is about an hour north of the cities.
Oh, okay, sure. And then so you can talk about like how does the animal sanctuary is nonprofit, like how does the funding work for that?
Yep, the animal sanctuary is nonprofit. It's run off donations. And then I'd have my business, and there would be the fee for therapy, and a portion of that would go towards the sanctuary. The animals are helping out, and that's another way that the animals benefit from this as well.
Right.
So yeah, my business would be a for-profit business.
Yeah.
But they would be getting a cut of that.
Okay. So yeah, everybody listening, if you want to check her out, is there a website or anything you want to steer people to?
Not yet.
Not yet. Okay.
Not for mine, anyways. Pharmastay has a website, but I don't know the URL off the top of my head.
I'll look it up and throw it in the description. So
awesome.
So I think that's all the questions I had. So and
cool.
Did the shout out. So so yeah. So thanks, sorry, Heather Muir, Cron Miller. Yeah. So thanks for listening, and we'll see you in the next one.